All right. Good day, everyone. Thank you, everyone, for being here. I am Nicole Jackson, the Director of Education with CEEJH, and I want to welcome you today to our Climate Justice Fellows Final Assignment Showcase. Excuse me. Launched in 2023, this virtual program educates individuals on environmental and climate justice, empowering our fellows with deep ties to frontline communities and address local challenges. Fellows progress through an intensive 10 to 13 modules curriculum culminating in a technical assistance project, a capstone project, or final assignment. Having been a fellow and senior fellow myself, I am proud to have redesigned this year's program to be more practical and global oriented. We centered everything on real world applications through our empowerment science framework, and that's empowerment spelled INPOWERMENT. Empowerment science was coined by our executive director, Dr. Sakobi Wilson. And empowerment science, we like to say, includes community based participatory research, community science, and the collaborative problem solving model. Fellows engage with assignments rooted in actual case studies tailored to their community specific needs. This philosophy culminates today in what you'll see as our fellows' final assignments. In a significant shift from previous years, we challenge fellows to proactively develop their own initiatives, moving beyond traditional capstone projects. They also gained hands-on experience working directly with CEEJH staff on technical projects from policy analysis to air quality monitoring. Excuse me. This practice-based model is implemented or was implemented on a scale expanding our fellowship across our global network for the first time. This year, we were thrilled to welcome a remarkable diverse cohort from 16 different countries, which helped us enrich our discussions and broaden our understanding of interconnected global challenges. If you or anyone you know would like to participate in next year's Climate Justice Fellows cohort, please contact us at fellows@ceej.org. Applications will be going out this month, and we will also have two information sessions, one on November 10th at 12 noon Eastern Standard Time, and one on December 16th at 7 p.m. Eastern Standard Time. Today, we're going to hear from two wonderful fellows, Stephanie Yarborough in Colorado and Dr. Lasisi Salami Lawal, located now in Botswana. So first, we're going to hear from Stephanie. Stephanie is located in Commerce City, Colorado, and is dedicated advocate for climate and food justice. Currently, also serving as a fellow with the James E. Clyburn Leadership Institute. She holds a master's in food and nutrition, a bachelor's in family and consumer science, and two associate's degrees in business, agriculture, and baking and pastry arts. A lifelong learner, Stephanie is passionate about building great products and solutions that makes people's lives easier and more equitable. With over a decade of experience, she has crafted innovative, human-centered strategies for a range of organizations, from small startups and political campaigns to some of the world's largest brands, including Walt Disney World. Stephanie blends creativity, leadership, and a commitment to community empowerment in every project she undertakes. Please help me welcome Stephanie.
Thank you so much, Nicole, for that introduction. And I'm glad to be here to share my presentation, share my screen now. Okay, can everyone see my screen before I get started?
Yes.
Okay, and again, my name is Stephanie Yarborough. My bio was already said, so I won't think I need to go and repeat what Nicole has just said. So, how my outline for my presentation today will be the story and my problem, the solution, budget and impact, policy, and I will close with any questions. As a 2025 Siege Fellow, my final assignment is a community service project, and I wanted to focus on improving the lives of unhoused individuals in the Wilmington, Delaware area, which I have named my project South Downtown Riverfront Renewal and Community Support Project. As you can see from this picture, this is an actual picture of the riverfront, but it's not the riverfront that I am speaking of. If you go like across on the other side, there's a riverfront that's it's beautiful, but it's um, hasn't been maintained, it's overgrown. And as you go make your way there, you see a lot of unhoused people that live along that alley. And that's what I will hope to be focusing on in this project. The problem is the rising homelessness in Wilmington, Delaware, encampments in the Christiana Park, drug overdose, and mental health crises. The immediate solution is phase one. I must admit, I had many iterations of my project, and the scope was way too big. And so I felt like I needed to break it up into small, manageable parts. So our first steps are simple, tangible, and compassionate by distributing emergency resource cards and care kits that connect people directly to help, by developing and creating a 5x7 laminate emergency resource and weather preparedness guide cards. Give out care packages, which will include but not limited to these items of ponchos, socks, gloves, personal hygiene, and first aid. Also, including a weekly outreach and connection to services. And I also feel like this first stage is really a good way to be familiar with the population and that population get familiar with me and where I can build trust within that community. Here's a prototype of my emergency resource card. This is just the first front of it. On the back will be the emergency preparedness, which I haven't actually did a prototype for that yet. But here you can see some examples of what the card will be able to offer the people that have it. They'll be able to find some resources that they may need to help them. As a long-term solution, which is phase two, we'll be building hygiene stations, showers, restrooms, laundry, and community gardens, workforce training with green jobs and peer support, and safe housing pathways. Community engagement will consist of resident-led co-designed workshops, peer advisory councils, which will be unhoused and formerly unhoused leaders, partnerships with Wilmington, Delaware nonprofit and city agencies. The budget for the first phase would be around 25,000, which would include the cards, care package, and outreach. And right here, I'd like to give a shout out to Miss Stacy Henry from the Delaware First Reliance Hub. I met her while I was at the symposium. We talked briefly there, but since we've been back in Delaware, I've spoken to her a couple of times, and she's excited about, especially this first phase, and is willing to help with these outreach and getting the cards and care packages out. Phase two expansion would be around 300,000, which would include the housing placement, hygiene stations, job programs, and the community gardens. Evaluation and impact. The immediate would be the 500 plus card distributed, 300 plus care packages, and I feel like 80% of the residents would use at least one of the services that would be listed on those cards. Long term, job created, reduce and drug overdose, and housing transition. Policies will align with Delaware continuum of care. The model is inspired by Maryland's Brownfields Revitalization Incentive Program and scalable to state and federal housing policies. This is a call to action. A strong tomorrow starts with a safe place to call home. Every with every conversation, every shared meal, every big brick laid leads us closer to a world where no one has to sleep outside. Today, let's choose passion, compassion. Tomorrow, we'll see the community we've built together. Join the movement to end homelessness. Volunteer, donate, and raise your voice because housing is a human right. And I like to end with one of my favorite quotes by Mother Teresa. Not all of us can do great things, but we can do small things with great love. Thank you for this time. And if anyone have any questions?
Thank you, Stephanie, for sharing very briefly. I do have a few questions for you, actually. Um, so I'll start with you've identified a good partner list. Could you speak about the existing relationship you have with these groups, if any? And for instance, have you had preliminary conversations with the Riverfront Development Corporation or the city of Wilmington about the long-term vision of your project? And if so, what was their response? And um, what do you see as the biggest potential barrier to getting diverse partners to align?
Yeah, well, I have not reached out to any city officials here, but the only person, like I said, that I have met was Miss Henry and spoke with her, and she's really knowledgeable in the area. And she also shared with me, which I had invited her here today, and I was hoping that she would come and she could speak on it because apparently Delaware is going to be addressing the housing population in this area in which I have chose as my project and putting, if I'm able to speak about it, which I don't know much about it, is they're going to be putting tiny homes in this area. And again, I don't know much about it, but that's about the gist of it. And she has invited me to come and be a part of that as well.
Okay, thank you for that. I do want to apologize. I noted that your location was in Colorado, so please forgive me. I forgot that you were in Wilmington, Delaware. One more question for you. You did outline within your proposal historical and current challenges. So, to help build a stronger case for funders and policymakers, what specific local data, such as the point in time count of unhoused individuals in the area, public health data on overdoses, or historical maps of industrial use, are you using to baseline the project and to measure historical claims?
Yes, I did have that in my packet that I presented as my
Hmm.
assignment, but I don't have that here to give out that data right now. But we do know that there is a wide epidemic of the fentanyl use, and then I can look out of my home and see people walking. You can tell that they're probably on drugs and things of that nature. But as far as the amount, the actual number, I don't have that, but I could get that for you.
Yeah, so why don't we proceed with Lasisi's presentation and give you some time to find that, and we'll come back
Okay,
to that
sure.
question at the end.
Okay, that'll work just well. Okay, thank you so much.
Thank
Yep,
you.
I'll
no,
stop sharing now.
thank
Okay.
you very much. So next, I would like to introduce our
Uh,
next fellow, Dr. Lasisi Salami Lawal, who is
Okay.
now located in Botswana, but recently
Uh,
located in Abuja, Nigeria.
yeah.
He is an associate professor in the Faculty of Engineering and Environmental Design at Danfodio University, Sokoto, with a distinguished career as an engineering manager in satellite operations and applications. He holds a PhD in engineering, multiple master's degrees in satellite communications and engineering, and an MBA. His groundbreaking research in digital health, which integrates satellite systems, excuse me, cybersecurity, and telemedicine, earned him the 2023 Institution of Engineering and Technology Global Impact Society Award. Dr. Lawal's expertise also extends to his role as the board chair for aerospace and aviation sector at Nigeria's Engineering Regulation Council, and his research interests include sustainable space, renewable energy, and ethical use of AI in healthcare. Please help me welcome Dr. Lasisi Salami Lawal.
Uh, Thank you very much for the introduction. I appreciate. I'm still in Nigeria, just still working out some requirements to move to Botswana. But at the moment, I'm still based in Nigeria. Without wasting much of my time, let me just go straight to my presentation, which is actually disaster recovery, resilience, plan, strengthening early warning systems, and institutional responsiveness, a case study of Mokwa flash flood, which happened early this year. So some of my outlines, exact summary, the case study, the community risk profile, vulnerability audit, of course, down to conclusion and recommendation. On May 28th, 29th this year, torrential rainfall triggered basically in a devastating flash flood in Mokwa for the first time, killing 161 people, displacing over 3,000 residents. Unlike typical floods from dam release, the disaster resulted from the collapse of an old embankment, exposing deep infrastructural and regulatory weakness, including the fact that we truly not paying attention to Nigeria's national adaptation plan too as well. So this is just pictorial view of that incident. You can see the flash flood as at March. I mean, you can see the area map of Mokwa before and after the flash flood. It's a 31 May 2024. How communities were submerged, none of that. The Mokwa flash flood occurred amid growing climate variability across Niger River Basin, where precipitation anomalies and water storage shifts have been linked to major flood events. Recurring flood cycles in the lower Niger systems are driven by intense rainfall, land use change, steep channel gradients, heightened flash flood risk, and all of that. Not only just Mokwa, also have similar incidents along the Niger River Basin down to Lokoja, the confluence state, in Kogi State, almost at the middle of not central part of Nigeria, where you do have, flash flood, flooding of that communities being submerged. Is an annual event, but they're more prepared. They're more prepared. They know they could predict when it happens, so they move to higher ground. So that was the contrast to Mokwa, flash forward. Women, children, the elderly persons with disabilities and low-income households face the highest flood impact due to limited access to early warning systems and evacuation resources. This group experienced prolonged displacement, post-flood health challenges, and reduced recovery capacity in Niger State context. Critical
Lasisi, if
infrastructure
I
gaps.
could
Yeah, yeah,
interrupt for a moment, we're not seeing your presentation.
yeah. Oh, really? Oh my goodness.
No, no,
Okay,
we,
let me take it. Let me share it again. Sorry, I need to
no worries.
share again. Oh, can it be seen? Is
Not
it on?
yet.
Okay.
Yes, can see it now.
Very good.
It says
Very good.
vulnerability
Great.
audit. Is that the one?
That's correct. Yes.
Okay.
Okay. Do I have time to go back to starting point? I should just continue from where I stopped.
Yes, you have plenty of time.
Okay. All right. So now, part of what we're looking at, the context of what we're doing as part of disaster resilient plan is integrating local knowledge with early warning systems, bias to satellite technology being a subject matter expertise on satellite infrastructure. And a lot can be done, integrating what is available on ground, situational analysis of what is on ground with institutions in terms of infrastructure systems. Part of what I'm doing now at the moment, trying to collaborate with relevant stakeholders to truly get to know, SWOT analysis of what we have on ground to mitigate against this kind of, issues. Scale 161 deaths in just one flash flood is worrisome. It is truly worrisome, and we should be able to do something about it. So indigenous flood prediction relies on traditional indicators, just like I mentioned about the Lokoja issue, which is quite very close to my hometown. So they know they could predict, which is a function of the river color, the rise in water, vegetation patterns, seasonal calendars, community-based systems of evacuation and preparedness, local fishermen, the role of traditional rulers informing the vulnerable people, community-based people to act and move to higher ground. Then integrating such local knowledge with modern science, enhancing trust, participation, and accuracy in flood broadcasting. So we're looking at the effective early warning system for Mokwa requires integrated forecasting infrastructure, combining satellite monitoring, for instance, Sentinel, GRACE, IoT sensors, hydrological modeling, or relevant stakeholders. We have institutional bodies, in place. So that's part of the next steps now, working to see what we can do, particularly with Obasanjo Space Center, where you have 3 institutions, NIGHTCOMSAT, where I work, which is about communications satellite. Then you also have the National Space Research Development Agency, responsible for observation satellite. Then, of course, Defense Space Administration, responsible for defense security issues. So strengthening institutional roles of NEMA, that's NEMA here is National Emergency Management Agency, similar to what is obtainable in US. Then NEMET, which is under Ministry of Aviation and Aerospace, predicting weather situations for the aviation, and of course, for issues like this on climate change. Then the National Hydrological Agency itself, state agency in particular, because state agencies play a bigger role in moving this down to subnationals, then down to local government, enabling coordinated forecast, data sharing, and timely relief deployment. Community flood preparedness committees, conduct simulations, which is already happening too as well as a result of what happened early this year. You can see the national bodies waking up to their responsibilities, conducting simulation exercise with key stakeholder in community-based system. So part of what we're looking at is, aside policy integration, institutional coordination, the need for institutions to coordinate. The era of institutions working in silos is over. You get it? So I think that's part of the biggest challenge that we have in Nigeria. There's need for some kind of coordinated institutional framework, which is also, again, enabled by the readiness of communication infrastructure. How do institutions talk to themselves, for, disaster preparedness? Then, of course, community preparedness. Then, of course, the issue of advocacy and policy integration to align with Nigeria's National Adaptation Plan by linking disaster management to agriculture, to health, to urban planning, promotes resilient infrastructure, early warning system funding, climate adaptive development. Now, the other aspect is recovery, rehabilitation, and knowledge integration framework, which is also very key. Immediate response includes rapid needs assessment, restoration of essential services, water, healthcare, and very knowledgeable on healthcare based on what I've done in the past, healthcare, particularly for vulnerable people, and the rising number of internally displaced persons camps as a result of security challenge and all of that, which is still part of disaster management too, but it's not climate induced, so to speak. Long-term recovery, which is adopting a build back better approach, reconstructing infrastructure with climate resilient designs, just like we're doing recently. The government currently is building a road that's resilient to flood across the coastal ways. So these are some of the things we need to begin to see too as well, in communities, in flash flood areas, particularly in the Niger-Benue Trough Basin. Then, of course, sustainable livelihoods are also promoted through climate smart agriculture, community-based insurance models, diversified income opportunities that reduce flood vulnerability. Then, of course, monitoring, evaluation, and traditional knowledge integration to some of this. What we have here is implementation timeline and resource requirements for it about 3 years. But part of what we've not integrated is rough order magnitude budgetary plan for this, which actually involves, situational analysis of what we have on ground, studying the national adaptation plan, then see where the gaps are, including the climate office that we have now at the moment, then President's Ecological Office. I've not been able to get response, so I couldn't integrate that aspect in the presentation. So it's work in progress. Finally, the Mokwa flash flood case study underscores the urgent need for an integrated community-centered approach to disaster resilience in Nigeria's evolving climate context. This recovery framework provides a pathway to strengthen early warning systems, enhance institutional coordination, and promote sustainable livelihoods through inclusive participation. By integrating traditional knowledge with modern technology, particularly satellite infrastructure, and aligning with national adaptation plan, the strategy ensures both immediate and long-term resilient outcomes. Ultimately, sustained interagency collaboration, very key, adequate resource mobilization, active community engagement with traditional rulers, religious rulers will be essential for building flood-resilient communities in Niger State and similar regions across the country, particularly the Niger-Benue Trough Basin. Work is ongoing to establish situational analysis of current institutional infrastructure and systems vis-a-vis Nigeria's National Adaptation Plan. Implementation, feasibility, and funding, as pointed out by Director of Education in some of the critique, is ongoing with stakeholders, particularly Ministry of Environment, President's Ecological Office, NEMA, NISA, NIMET, etc., after submission of recommendations. Thank you so much. Thank you. Question and answer, please.
Thank you so much, Lasisi, for your presentation. I do have a few questions for you as well before we go back to a few questions for Stephanie.
Okay.
So one, your monitoring and evaluation framework that you shared about in the paper,
Yeah.
I think is really good. So beyond measuring reduced deaths and displacement, what are one or two key indicators that you could use in the first 3 to 5 years to prove that the system is building on long-term adaptive resilience and not just improving emergency response?
That's good. As shown in my implementation time, part of what we were doing, we cascaded implementation plan, borrowing ideas from my past projects into 3 phases. Then at the end of every phase, there will be evaluation monitoring of what has been done. That's every six, like the first phase is months 1 to 6, which actually implies establishing interagency coordination mechanism as it is, conduct comprehensive community risk assessments, then begin installation of basic monitoring infrastructure with relevant agencies, because this is not institutional framework is required. Then, of course, initiate community preparedness, which is more of sensitization, awareness. Then, of course, community formation and local government. Part of what the Mokwa flash flood exposed is our preparedness stops at national level. It doesn't filter down to subnationals and local. And I'm happy also state governors are beginning to wake up to their responsibility by setting up also similar agencies at national level down to state level. That is already happening too as well, which is good for us. Then, of course, system development, deploy integrated. Part of what this means is also study what is already available. It's not just, get it, study what is available out there, just like you have in the UK, in China, for instance, with their own kind of landslides system. I've learned a lot from that because I am always a visitor to Wuhan University in China, which is where the GNSS national infrastructure is. And what they've been able to do is to utilize global navigation satellite system to predict when landslides happens. You get it, with indicators as red means evacuate, yellow warning, then green, everything is okay. So there's a learning curve from what has been done in other places, even though it's not completely related to climate change, is no flush, but these are something that has to do with landslides and all of that, which is part of what we can do too as well, particularly even in collapse of infrastructure, which was the case in the case of Mokwa. So there's a lot to do there. You get it. Then, of course, evaluate some of these systems and adapt them to local needs. Adoption and adaptation. That's part of what I preach in any systems I'm doing. The 5 A's of technologies. It's not just about affordability, accessibility, availability, but adaptation and adoption of such technology to meet the geographic local needs and contexts, not just, copy a technology and dump. That's part of the learning curve in the telemedicine community-based project that we did last 2 to 3 years. Then, of course, full implementation at the end of the 3rd year, which is achieve full operational capacity for all system components, complete community preparedness infrastructure, implement monitoring and evaluation systems. There should be a feedback. There should be simulation exercise, just like we're beginning to see, the national body waking up to their responsibility to go about, how to, recover from disasters when they happen. How do agencies coordinate? We've seen improvement in such actions with simulation exercise. That's part of the evolution to then begin adaptive management and continuous improvement processes, and in particular awareness, sensitization. Then, of course, gender, because we also realize that there's gender issue today. Children and women are more vulnerable to disaster situation. This is the truth. So this is part of what. So we also, and happy you pointed out, Director of Education, Nico. Integration of also there should be gender equality. We must be saying to include gender. There should be gender balance in committee setups and all of that to bring their own perspective to issues. Thank you.
Yeah, thank you so much for that very thorough response. I did have a few other questions for you, but I'm just going to ask just one more now,
Okay.
because this was an environmental justice fellowship, right? So I want to talk a little bit about community ownership and power dynamics. So also you emphasize community participation, which is, excellent. So tell me a little bit about how you would structure the community flood preparedness committees that you mentioned. to
Yeah.
ensure that they are truly representative and powerful, but really representative of the community, but
Yeah.
preventing them from becoming dominated
Yeah.
by local elitists or the more affluent folks in the community. And how
Yeah.
would you go about ensuring the voices of the most vulnerable community members, like landless tenants or women headed households, are heard and acted upon?
Yes. There's a thank you for this question. There's also a great learning curve from what we did in telemedicine project, that communities are more responsive and they listen more to their traditional rulers and religious leaders when they have a buy-in. So for us, it's not just bringing something from nowhere and dump at the community. We very important, particularly in a developing nation and particularly rural Africa. There must be buy-in first, some kind of collaboration, ideation with community-based traditional rulers, with youth leaders, with community market women, their leader, with religious leaders, Christians. Nigeria is predominantly Christians and Muslims. So a buy-in from such leaders, community-based leaders, then wins the aspect of awareness and sensitization. That's one of the learning curves. So our own strategy is to also make sure whatever we want to do, you get first the traditional rulers, community-based leaders, cutting across youths, women, market women, of course, too, as well. Then traditionally must have a buy-in. They must, so that they will also be able to disseminate something, you get it, down to their local leaders in wards, streets, and there will be a complete buy-in. This is part of if there's anything to learn from our community-based health and project. So these are the kind of thoughts line two that we have, that we must do this, and it must be part of our implementation plan. You get it, so that there could be that takes care of the awareness aspects, before utilizing digital media like the Facebook, the radio, community radios, and all of that. But first, at the community level, there must be such awareness and sensitization, with the traditional rulers, because people are more, particularly in rural areas, they listen more to religious and community-based chiefs than even government officials. Yeah. Thank you. I hope I answered that question in full.
No, you did. Thank you so much.
Yeah,
I
yeah,
appreciate that.
yeah.
Stephanie, do you have any questions for Lasisi before we come back to the questions we had for you?
No, I don't think I have any this time. Thank you for.
Thank you so much. Thank you, Stephanie.
Thank you. So yeah, Stephanie, I would love to come back to the question that I had for you about the data.
Okay.
So I'll repeat the question. To help build stronger cases for funders and policymakers, what specific local data, such as point in time, count of the unhoused individuals in the area, public health data on overdoses, or historical maps of industrial use, are you using as a baseline for the project and measuring its historical claims?
Right. Okay. I'm going to first deal with the drug crisis and overdose in Delaware. And what I found was in 2023, which is not kind of old data, but at that time, 527 accidental drug overdose deaths, which was a decrease from 2022 of 1.8%. But the state has one of the largest overdose deaths in the US in 2021. And Delaware is considered as the largest supply. It's 11 o'clock. Oh, I'm sorry for my laptop going off. I'll start that back over. Wilmington is considered as the largest supply base for heroin. If I'm saying it right, heroin. And far as the homeless is concerned, according to statewide um, point in time, Delaware recorded 1,358 people experiencing homelessness, which I would like to do a side notice to say there is a lot of unhoused that are hidden, realizing that there are people that live in hotels, in their cars, um, on friends and family couches and things of that nature, which I feel like it's not wouldn't be in the data per se. And according to the hub allocation plan for Wilmington, it is noted that in 2022, statewide data suggested 2,369 people were experiencing homelessness. And that's all the data I have from your question.
Thank you, Stephanie. I did want to give you the opportunity. The other question I asked you, you said you had some additional information to share.
Um,
You mentioned and Miss Stacy Henry, who I see has joined.
yeah. Hey,
Yeah,
Miss Stacy.
and you said you wanted to share some additional information.
Hello.
Well, no, well, just in reference to your question, you asked, had I uh, reached out to any government officials in Delaware. I was just saying that I had partnered or connected with Ms. Henry, and she had mentioned a plan that I think the city, the government is coming up to handle some of the homeless situation within the area in which I had mentioned.
Oh, okay, okay. My apologies, I misunderstood. Okay, well, then if that is it, I want to thank you both for your presentations of your final assignment. And I do want to remind individuals that may be watching the stream that we have two information sessions about climate justice fellows coming up on November 10th and December 16th. And also, we have another Climate Justice Fellow session tomorrow where we will have more of our fellows presenting their final assignments. So please join us tomorrow at 4 p.m. Eastern Standard Time if you would like to view more presentations. Thank you so much.
Thank you.